It is not all dark and gloom. With heightened public awareness on communicable diseases generated by COVID-19 pandemic, there is no doubt it will bear some positive effects. The average person now clearly realizes that personal hygiene and sanitation can play a vital role in preventing disease transmission. We delved deeper into some of good sides that have emerged as a result of renewed public behavior in curbing the spread of COVID-19. So far, frequent and effective hand washing, improved environmental sanitation is a sure way of avoiding exposure to viruses, as most people, if not all, are complying with containment measures. In a bid to flatten the COVID-19 curve, improved hygienic practices on national scale will likely reduce the burdens of other diseases such as flu, colds, typhoid, dysentery, and other viral agents such as norovirus, and can also limit the spread of some bacterial agents.
We are now a cleaner nation, I can say that for sure, because I work in a hospital where, and day in, day out, the biggest number of my clients were children coming in with infectious diseases, the common colds, the diarrheas, and all that. But now we hardly ever see those kind of cases. Even the common colds, the running noses, they have all reduced because of the measures that we take. The social distancing, the wearing of our masks, they are all on point and preventing us from catching these diseases.
When good hygiene is practiced, it becomes part of life. These beneficial behaviors are then passed along to children and pay dividends in better health and long life for generations to come. In the long run, the preventive actions act as a guarantee of controlling future pathogens should they emerge.
Creating habits that we are reminded every day, like for our children, you can't just cough. You have to learn how to cover your mouth. And that is a habit that I can tell you for a very long time will be repeated. Sanitizing and washing hands. And of course, that is caring for each other. And those are good habits. And good habits are really helpful for all of us in the families and also in the communities.
In the country, children have benefited a lot by having their parents around them. Psychologists say most of them having flexible learning schedules and more time to learn from their parents has improved their livelihoods in some way.
Being a therapist, one of my clients who just told me that the reason she wanted me to help her out is because she could not relate with her mom. Only to find out that this time, being forced to be with mom most times in the day has really improved their relationship. So even as a therapist, one of the things that has really helped people is just having time together, and that, having time and being able to communicate with people really can change relationships.
According to a research done in Spain on psychological impact of COVID-19 on families by Rocio Collado in June this year, participants with children who were older than 10 years and those who had children generally had lower levels of anxiety compared to those without children.
We are told that children staying with parents, having quality time and quantity time benefit them. And we have seen children love it when they've had their parents be with them.
With life curtailed by COVID-19, many have had some good time to reflect on issues around them. Psychologists say having a rest after dinner is important. It says one's gut, brain, and immune system thrive on that downtime in order to give you their best performance, and you will sleep better too.
This has been a good time to reflect. Looking at your life, finding out, are the things that I do every day so important? And so it's given us time to be able to look back. What have I been able to accomplish? What am I able to even accomplish? What are the things I need to put more priority, more time to? And of course, what are those things that have not added a lot of value in my life?
Healthy eating has also been given a boost. In this season of COVID-19, most people have more time at home with their families. Most have had no choice but to prepare fresh food at home, as opposed to times when people relied on fast foods to satisfy their hunger during busy working schedules.
And health is wholesome. It's the mind, it's the body, it's the spirit. So what you put in yourself actually contributes a lot to your health. Not just what you think or what you do or the medicine you take, but what you eat. So we've found that many people are actually eating healthier now. If you take fruits that are high in vitamin C, you'll actually get overall immunity, not just against corona, but against so many things.
I've realized that there are some recipes that she does, and she puts the natural things like lemon. Those things are very important for to help us, even in this season.
Ginger, garlic,
ginger.
coriander.
might realize that maybe you had corona and it disappeared.
Yes.
Families seem to have taken the day, as many relationships thrived through spending a little more time together. Psychologists feel most issues that have caused challenges like depression have taken a downward turn.
We know that any time in relationships where you give time to a relationship, that relationship happens to even grow. And I think even in the country, we have seen people mending relationship. I'm told of a friend of mine who was talking to me and told me that she had even taken her daughter to see a psychologist. During this COVID time, spending time with the mother has actually resolved that bit that they could not communicate with the mother.
Ellie's family shares more on how they think families have benefited by spending time together.
Even in this time of COVID, it is an opportunity for us to build relationships. It's an opportunity for us to maybe talk about things that we never... Issues that we had never...
under the carpet for years.
Yes. And I know ladies are very happy this season.
Yeah, we are very happy.
This COVID pandemic season has also pushed people to think out of the box, as most have had to think deeper on ways of creating income and solving challenges around them.
You know that there are quite a number of people who've lost livelihoods. Others have had their incomes reduced. They've had to take pay cuts. And but we have had a few innovations, because sometimes when you're between a rock and a hard place, that is actually when you look up and you see where your destiny lies. So we've had even... I know you've been seeing in the media about this gentleman who was making ICU beds, and they were very good quality. This is promoting the local industry.
First of all, you've seen so many different masks that are around, and that shows that people are so creative. And then there's also the aspect of people being even entrepreneurial. People who never used to, think of doing something online. So there's a lot of online business going on. And also people are trying as much as they can to stay sane, and also to look for money and, a source of income for them to at least be able to foot their bills.
With most people having flexible work schedules and others working from home, this has brought a change in lifestyles, which in return is helping to reduce health complications.
It is recommended that everybody should at least do 30 minutes of exercise per day. It doesn't mean you have to go to a gym. It's actually even moderate walking, brisk walking, where you get your heart rate up.
Even psychologically, when people exercise, what happens? You kind of release stress hormones. So people are less stressed when they exercise.
As many venture into exercising, Naomi, a physiotherapist, says one needs to go out there with the right shoes and right attire in order to avoid unnecessary pain from the exercise.
There are so many things that people need to know when it comes to doing sports the right way. Coming from the proper sportswear like shoes, proper shoes, warm up, stretching before and after exercise, all those together help to prevent sports injuries. But if you just venture into sports, say with the wrong shoes, you will come to us with feet problems. You have aching feet because you went on to exercise with the wrong shoes.
Dr. Karanja has, however, advised everyone to keep up the good habits in order to curb the spread of COVID-19 as well as other diseases caused by germs and viruses in the society. Whereas the pandemic has brought this flip side, it is important to note that the road to recovery is still uncertain. Having been in the front line in the fight against COVID-19, Dr. Karanja warns that the country is not out of the woods yet.
I have managed COVID-19 patients, so I know when I tell you that the cases are rising, that we are not out of the woods, I exactly know what I'm saying. So that means we should continue to wear our masks. And by masks, I don't really mean that everybody should go out and buy an N95 mask like the one I'm wearing, but you should wear a form of facial covering. What do I mean by a facial covering? Anything that will keep your saliva and sneezes to yourself. Is it a handkerchief? Is it a bandana? Is it a scarf? Is it a mask, cloth, or surgical or medical? It doesn't matter. But if we all wear our masks when in public spaces, we protect each other. And that is not to say that we forget the social distancing. We should still keep 1 meter apart from each other.
Since we all have a role to flatten the COVID-19 curve, strong family ties, healthy eating, and positive attitude should be our goal to attain a wholesome lifestyle, because it is not all dark and gloom in this season. Reporting for Hope TV Newswatch, I'm Faith Imani Mugo.